Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is the Situation Report on Epidemiology for the 11th of October. Again, fluctuating. Overall, epidemiology is falling in some parts of the country, gently rising in other parts of the country, most notably falling massively in Northern Ireland. The prevalence halved over recent weeks. Slight fall in Scotland. England is beginning to rise. A couple of weeks ago, prevalence was about one in every 85 people. Now it's one in every 70. It's going up, and kind of going up is a bit of a concern. Sheffield, onto ours, largely flat, hovering just above 300 per 100,000. Goes up, goes down a little bit, but it's been hovering about that rate for a good few weeks now. Rates are very high in the under 12s and the 12 to 15s, to a lesser extent in the 16s and 17s, and is actually beginning to fall gently in that group, particularly if you look at tests as a 7-day rolling average. So apart from children and young people, we're in a reasonably flat position epidemiology-wise. Some signs that the rate of increase is slowing in the 10 to 15-year-olds and may have peaked, probably a bit too early to call that. Mostly flat in all of the other age bands. Flat but high, way too high for comfort. A&E attendances are creeping up, well above the baseline this time of year certainly. Primary care is exceptionally busy, still vaccinating people, but also busy with routine care and also the care as a result of COVID. Hospital numbers hospitalised because of COVID, drifting downwards, drifting very slowly downwards. Still problematic, high numbers, and one or two doublings would lead us into very, very deep trouble very, very quickly. So we all want this to be over. It isn't over. Pretty good uptake of vaccination in school-age children. Too soon to have good data on this, so going on the feedback that we get from the Children's Hospital doing school-by-school vaccination clinics, and progressing as fast as possible. And the evidence is that that is making a difference and protecting people from infection. No vaccine is 100% effective, and COVID vaccination is just the same. But the evidence is that as the age cohorts get vaccinated, transmission rates in that age cohort goes down. My biggest worry over autumn and winter is not necessarily the COVID stuff, it's everything else. COVID by itself is probably just about manageable, but all of the wider issues, ambulance pressure, primary care pressure, those are the things that are going to cause me problems over the winter. So on vaccination programme continues, and undoubtedly been a huge success in Sheffield. Some points to note: the rate of first vaccinations is now flatlining, so it's very, very few new people are coming forward for their first vaccine now. And one of my critical risks for the coming period is the unvaccinated adults, particularly older adults. Those are the people I worry most about. It was in the news today that 1 in 6 of the most critically ill people in NHS hospitals are unvaccinated pregnant women. I can't stress enough that it's safe to get vaccinated, and it helps both you and baby keep safe. The risks to you and your baby if you catch COVID, especially in the 3rd trimester, massively outweigh the risks of the vaccination, which in my view have been hugely overplayed. Vaccinations are available at our NHS Vac Clinic at Longley Lane 7 days a week, or at lots of grab-a-jab walk-in clinics across the city. They change from week to week. If you're unsure or have any concerns, talk to any of the clinicians at any of the clinics. They'd be really happy to talk to you. School vaccinations are continuing to progress, and you may have other children at school who haven't yet had the vaccination because the team haven't got to the school yet. Could be an opportunity for you to reconsider if you haven't yet had the chance to get your vaccination sorted. All of our clinics are family friendly if you've got nobody to assist with childcare. There are high rates of transmission in school-age children right now, and that there's always the risk that children transmit the virus to their parents. So if you haven't yet been vaccinated, it's really, really, really important that you do. On travel, there are new changes coming into play for travel. If you're thinking of travelling abroad this autumn, then being vaccinated makes it easier for you to travel. Now is the perfect opportunity to get your first or your second dose before you make plans. Most destinations are beginning to ask for proof of vaccination, and that will be you need to demonstrate you've got 2 weeks after your second dose before you travel. So you may not be able to travel if you haven't been double vaccinated. Again, another reason to get jabbed. Don't run the risk of a positive PCR test, cancelling your holiday plans. Being vaccinated can significantly reduce your chances of that positive PCR test. Lastly, on boosters and third jabs, booster vaccinations are being offered to the same high priority groups as per previously. So it's age based and it's the population over 50, health and care staff and people in care homes. They'll be offered a booster jab 6 months after their second dose. Waits to be contacted by the NHS with an appointment. The third jab is different to the booster jab, and the third jab is for those aged 12 or over who are immunosuppressed. And again, the NHS will contact those who are eligible on or about today. So if you haven't heard today, the 11th of October, you'll probably have heard over the next few days. But it's important, wait to be contacted. Don't proactively make an appointment just yet.